the place to be. Hello, everybody. I am so excited today because I get to help you do what I love doing. I've been doing NCLEX instruction for 10 years now, over 10 years, and the process to your nursing license is very much the same. All right, studying the content, applying the critical thinking, and this is how we will get it done today. We're going to break down nursing content, and I have some awesome critical thinking exercises for you to do. All right. I also will be bringing Monday motivation. And our Monday motivation topic, you know, the Monday motivations are always something personal to me, near and dear. And so the Monday motivation topic today is this: who loves excuses? Who loves excuses? So if you've been making excuses for yourself, we're going to get rid of that problem today. Hey, did you know that in my NCLEX virtual trainer, we have over 6,000 nursing students right now studying, actually 6,600 to be exact, who are on their way to passing their NCLEX. And because I know you guys are going to pass, I am doing this again. We are having another ReMar Nurse NCLEX party. I hope you guys can join. We are going to do it during the New Year's celebration. And so if you want to get started in the NCLEX virtual trainer, it's super simple. Just head over to Remarnerscom. Okay, are you ready for the first question? We are doing critical thinking exercises. So if you've been studying your content, now is the time to put it to the test with me. So I have a question for you. One of the problems that students always say is, hey, Regina, I can get it down to 2 choices and then I get stuck. I don't know what choice is the better choice. So for our critical thinking exercises today, I've already narrowed it down to 2 choices, and I just want you guys to pick the correct one. So here we go. Question number 1. Welcome everybody joining me from all over Africa, Jamaica, Florida. I'm in Florida right now. Ohio, shout out to you guys. The question is, a nurse is working on a medical surgical unit. Which client should she see first? Is it number 1, a client with a temperature and frequent vomiting, or 2, a client at risk for respiratory infection reporting leg pain? Here we go. I'm so happy you're here with me today. Shout out to the ReMar nurses. I need an answer, and then I need you to smash that share button. We are studying critical thinking today. Is it number 1 or number 2? A nurse is working on a medical surgical unit. Which client should she see first? I see the answers rolling in. Don't be afraid. Don't be afraid to put your answer down. This is what we do here. All right. And remember, I'm going to go over every rationale. We're going to think our way through this because at the end of it, I want you to be confident in your answers. All right. Okay. So I see a lot of 2s. I see a couple of 1s. What is the right answer? I'm going to show you. We're talking about priority here. What is the priority of the nurse? And so when you look at these 2 clients, the priority is absolutely going to be number 1. Number 1. And you guys might be asking, hey, Regina, why is it number 1? Well, let's look here. Let's critically think. This client 1, has a temperature and frequent vomiting. Okay, so they actually have a problem. They have a problem. And assessment is needed by the nurse to figure out why they're having these symptoms. I fooled you guys with number 2 because I put respiratory in there. But is this an actual problem that the student is having? No. It says is a risk for a problem. Okay, so the client does not actually have that problem. So remember, when you're doing priority, you have to go with the actual over the potential problem. Okay, so the first client actually had a problem. The second client only was at risk for a problem. Respiratory infection. You guys gotta look, because the actual problem that they're reporting is not respiratory at all. It is what? It's leg pain. It's leg pain. So we have two clients. The first one, temperature, frequent vomiting. The second one, leg pain. So who do we go with? All right. A lot of people fail NCLEX because it's not because they don't know the content. They do know the content. It is because they get caught up in distractions. It's because they're easily distracted. And so I really want to break you guys out of that nasty habit of getting mixed up with your distractors. All right. Because there's triggers that as an NCLEX instructor, you guys will always fall for. Whenever you guys see respiratory, when it comes to priority, most of you guys will jump to that answer. And if you do that on the NCLEX exam, you're going to get it wrong. All right. And you're going to fall below the passing standard. And we don't want that around here. We want you to get your license. Let's try another one. All right. Here we go. This is the second question. All right. Critical thinking. A nurse is caring for a client with VTAC. Right? We all know VTAC because I went over it with you guys in the virtual trainer. The lunch tray of the client arrives. Which items should be removed? And this is select all that apply. All right. I know you guys love this question. All right, here we go. So talking about a client with VTAC, they have their lunch tray. Which items should be removed? Select all that apply. The choices are: number 1, 2% milk. 2, a large chocolate chip cookie. 3, steak chips. 4, a can of Pepsi Cola. 5, grilled spinach. Oh my goodness. I know you guys love the select all that apply questions. Remember, one or all of them can be correct. One or more, one up to all of them, okay, can be correct. Come on in if you're just joining me. This is ReMar. This is the ReMar Nurse Monday. This is what we do every Monday. All right. Okay. I see the answers that you guys have. Great job. Great job. You are doing really well today. One or more answers can be correct. I'm going to give you the answers in 3, 2, 1. Pow. It is only number 2 and number 4. Only number 2 and number 4 here. All right. Why do you ask? Let's look at the rationales. For your NCLEX exam, there are certain words that trigger that it's incorrect. So for this one, number 2, you see here a large chocolate chip cookie. Well, what's wrong with that? Number 1, large portions of anything on NCLEX is a no-no. All right. When it comes to food, large portions of anything is going to be wrong because it can create all types of gastrointestinal discomfort. This here, however, is a large portion of a chocolate chip cookie. What's wrong with chocolate chips? What's wrong with chocolate here, guys? Why don't we want chocolate for NCLEX? Because chocolate has caffeine in it. Yes, I saw somebody put that. Chocolate has caffeine in it. And for your patient, remember what the issue is for the patient. The patient has what? The patient has ventricular tachycardia. So their heart is already stimulated. So we have to keep our patient calm, keep them non-stimulated, right, through their diet. And so no chocolate, and then no Pepsi Cola. Pepsi Cola at all. Yes, soda is a no-no here, especially Pepsi Cola, Coca-Cola. What else has Pepsi in it? Dr. Pepper, does it have Pepsi in it? Fact check me on that. But any kind of sodas that have caffeine in it. All right. Are you guys tracking with me? Are you guys doing well? Okay. Everything else on here, not an issue for a cardiac patient. All right. Not an issue for a cardiac patient at this time. All right. Are you guys having a good time studying? Because I am. This is fun to me. This is how I like to study. I am moving on. Another question coming right up at you. 2 choices. Pick the right one. Here we go. A nurse is working on a critical care unit. Which client should she see first? Is it 1, a client with an arterial laceration who is hemorrhaging? Or 2, a client with signs of hypovolemic shock? Oh, yes, I did. Hardcore Regina is back. She's back. I'm really getting on you guys. It's the end of the year. You don't have your license. You need to get ready. The exam is coming. All right. Who is the priority here? Is it a client with an arterial laceration who is hemorrhaging or hypovolemic shock? This is a really great question. I love how it's written because I see that a lot of you guys are confused. You don't know, you're picking the wrong answer, and that's okay. I want you to get it wrong here with me. So when you see it on your exam, you'll get it right. That's the goal. Okay. All right. Lots of number 1s, a couple of number 2s. Don't worry. Just go ahead. Just try your best. Okay. Just try your best. I am so excited. Almost 700 nurses right now are joining you studying for your NCLEX exam. You're not alone here. We're a family. We study together. All right. I'm going to show you guys the right answer here. Oh my goodness. Okay, here's the answer in 3, 2, 1, pow. Number 1 is the correct answer. Absolutely. Great job. Great job. Okay. And let's talk about why number 1 is the correct answer. We have 2 patients here. Essentially, both of them are having issues with their with their blood pressure, right? With their heart rate. But one of them is worse than the other because the patient with the arterial laceration also, not only are they having hypovolemia problems, but they also are traumatized because an artery has been severed, an artery has been cut. So they're losing blood, while the other patient, they're having issues with shock and hypovolemia, but there's no trauma to the body. Everything is contained inside. So number 1 is the patient you have to go see first, because what is the treatment for an arterial laceration? Is that something that we could just put a Band-Aid on? Is that something that we can just say, oh, it'll resolve itself? Let's give some IV fluids, because we're going to treat hypovolemic shock. The second patient, we're going to give them some IV fluids, right? We're going to give them probably some vasopressin to help them keep their blood volume, hold on to the water. But if we give IV fluids, if we give vasopressin to somebody with an arterial laceration, is it going to do much good? No, because the artery is just squirting out blood. And you guys know when an artery is severed, the blood goes everywhere. It's not just a little slow trickle. There's force behind that blood loss. So client number 1 is the priority. All right. Client number 1 is the priority. Okay. Woo, I'm so happy you made it here. I just have a few more questions. I'm not going to keep you guys long. This is our quick power study session today. So I'm going to show you the next question. Here it is. Ooh, I like this one. Which blood gas should the nurse expect to see in the client with an addiction to cocaine? Oh my goodness. Here we go. Is it metabolic alkalosis or metabolic acidosis? You got to know these ones. You got to know this one. All right. There's no numbers here. You have to be able to do arterial blood gas interpretation by diagnosis. All right. And I showed you guys a quick way to do that. And so I hope you got it. I hope you got it. Go ahead, put the answers down, smash that share button. We have almost 800 nurses studying. I love it. Can we get to 900? If everybody smashes the share button, we can get to 900. All right. So here we go. All right. I have tons of questions like this. If you love these questions, get into my virtual trainer because I have tons of questions. I literally wrote these questions based off of the student workbook for the NCLEX virtual trainer. So you guys know these. If you need a review to pass NCLEX, this is the one for you. All right. I'm going to show you guys the answer. I see a lot of 2s, and I am so happy if you picked 2. Shout out to the ReMar nurses that are here. I see you guys. Metabolic acidosis. Cocaine is a medication that will be metabolized, right? It's going to be metabolized through the kidney and the liver, and it will produce a low blood value, okay? A low pH blood value. And there are some really easy steps that I teach on how to get that answer very quickly. So congratulations to all the ReMar nurses that knew it in like 2 seconds. But trust me, this is something that can be learned and you can teach it as well when you become a ReMar nurse. That's what I hope. All right, here we go. I'm at one more question for you guys. It's a priority one. And here it is. Which is the highest priority of the nurse? Number 1, obtain a blood specimen of a client with an active infection. Or 2, insert an indwelling catheter for urinary output monitoring in a client with fluid overload. Let me say that again. What is the highest priority of the nurse? Obtain a blood specimen of a client with an active infection. Or 2, insert an indwelling catheter for urinary output monitoring in a client with fluid overload. Let's get it, ReMar nurses. Put the right answer on the screen. You can, you will, you must pass NCLEX. And this is the way to do it. Content with critical thinking. All right. And I'm here to help you. I'm here to guide you every step of the way. So there is no excuses. No more excuses why you can't get this done. This is it. Don't let your friends test alone or study alone. All right. I brought 800 other people here to help you study. All right. My information, my way, the quickest to get your license. Let's go. All right. So I see the answers coming in. A lot of you guys picked number 2. Very interesting. I'm very happy you showed up today. If you picked number 2, because the correct answer is actually number 1. And don't sweat. I'm going to tell you why. All right. Because number 1 is more time sensitive. Did you know that time was a priority on your NCLEX exam? Absolutely. You better know how to incorporate time, because if you have a client with an active infection, you need to know how much is in their blood. Their blood is very sensitive. All right. And it will help you to determine the right treatment. That's why we do things like a peak and a trough, right? That's why we look at blood at certain levels after medications, so we can know, is this effective? Is the medication toxic? We're trying to treat an active infection. These are considerations that you need to have in your mind when testing. All right. Number 2, what are we doing here? We're just doing some fluid monitoring, right? We're doing some output monitoring, some I's and O's. So really, what is the priority? Is your priority going to be an active infection, the blood specimen of that active infection, or is it going to be monitoring the urine of a client with fluid overload? Okay. Think about it. These are the steps that have to be considered when you are testing. Okay. All right. And if you want more questions like this, guess what? I give them all the time. We do this every Monday at ReMar Review. You guys know that. And also in the virtual trainer, there's a ton of other questions. I also am doing Saturday Night Live. So if you guys have not, let me show you the website. If you guys have not joined me on Saturday nights to do critical thinking questions, shame on you. All right. Remarnerscom and give me your email. Just put in your email, and every time I go live and anytime I do a study session, you too can have that information. Okay. I don't want you to miss it. Now, our Monday motivation. Okay. So this is the website that you guys are seeing come up. When you go to remarners.com, you're going to learn more about me and more about my program. All right. The content, the clinical thinking, my pass rates. All right. Why the virtual trainer is helping students all over the planet. Okay. And what I'm doing now is just a small preview of how we break down the core content. I also like to give you guys a little Monday motivation. And so the Monday motivation for today is who loves excuses? All right. Oh my goodness. What is an excuse? If you are used to giving excuses or used to receiving excuses, you know that an excuse is a release from a duty or a requirement. Because I've been doing NCLEX instruction for so long, I am a master of nursing students' excuses. All right. You guys have a ton of excuses why you have not gotten your license. And I'm just going to keep it real with you today. All right. The excuses that we tell ourselves about studying for NCLEX, these are them. These are the most common ones. Number one, it doesn't take all of that to study for NCLEX. It don't take all of that, Regina. I got through nursing school. I'm not doing all of that to study for NCLEX. I'm not taking 6 weeks out of my life. I'm not setting aside time to study. I'm not giving up in Netflix. I'm not giving up Facebook. It don't take all of that to study. A lot of you guys underestimate the process and you think that you can just passively study and pass NCLEX. Not so, not so. Another very common excuse is I am too tired to study. Okay. I am too tired. If this is you, just say, this is me. All right. If these are your excuses, just self-identify. A lot of people say, I'm too tired to study. I'm working. I am, I have kids. I have all these excuses. The sun is out. It's raining. I'm too tired. Okay. Let me tell you guys something. What you're too tired of is going through your life without a license. That's what you should be tired of. Living without your nursing license when you are educated to be a nurse means that you're not getting paid your worth, you're overworking, you're spending too much time away from your family, right? Is this any of you guys? Right? And so that's what we're tired of. We're not tired of studying. We want to study because it's going to produce results for us. But the job that you're currently working, if you're not a nurse, that's what you're tired of because you're not getting paid what you should be getting paid. All right. So this is Monday motivation, keeping it real with you guys. Somebody needs to hear this. Another excuse. Oh my goodness. This one really gets me. Nursing students say, I'm only using free stuff. I'm not paying to study for NCLEX. Oh my goodness. I'm only using free material. I am only watching YouTube videos. I'm only, I'm getting stuff other people give me, stuff I find along the way. Let me tell you guys this. When it comes to preparing for NCLEX, it is an investment. All right. You have to be willing to invest and don't look at it as I'm investing in books or I'm investing in a program. You're investing in yourself. That's the investment. You paid however much money to go to nursing school, right? You had to be trained to go to nursing school. You have to be trained to pass this exam. That's the way it goes. When you try to only use free resources and not commit to buying anything, it ends up costing you more. All right. Did you catch that one? I'm going to say it again. Free costs you more. Free stuff ends up costing you more. All right. So I'm trying to get you guys to switch your perspective because free costs you more in time. All right. Free costs you more down the road because if you're studying with free stuff and you're trying to patch it together and you got 50 million different resources, what's going to end up happening? You'll fail and you'll have to pay because you tried to do it the free way. You'll have to pay to take NCLEX again. You have to pay for your AT&T. You have to pay for your private tutor, right? And private tutors cost anywhere up to $100 an hour. All right. So I'm trying to tell you guys, this there's a way to do things when it comes to getting your license the most effective and efficient way. And free is not always the way to go. All right. Another thing is this. I failed last time by doing X, Y, and Z. These are excuses we tell ourselves. All right. We tell ourselves these things. I failed last time by reading, by studying hard. I failed. All right. I failed and I did everything I was supposed to do and I still failed. So I'm giving up. Okay. What I want to say to you is this. Do not let the past keep you from progress. Do not let the past keep you from the ministry you're supposed to be in. All right. So when you're studying for NCLEX and you've had failure in the past, you have to be able to let it go. You have to be able to get up and try again. When you see a little baby and a little baby is learning how to walk, it is a difficult thing. They have never done it before, but they have gotten the strength. They have gotten some training. They have looked and saw that other people can do it. And maybe on their first attempt, they stand, but they fall down. Maybe on their first attempt, they can take one step, but they fall down. But you don't see babies saying, I'm not doing this anymore. This walking thing is too difficult. I have done everything that I was supposed to do. I've done everything I've seen, and I still cannot walk. Just forget it. No. When you see babies, they get up, they fall, they get up again. They get up, they fall, they get up again. However many times it takes for them to learn to walk. All right. And it's the same mindset you have to have with this NCLEX thing. However many times it takes, I need to do this thing because it will change my life. That is the whole reason why every Monday, Team ReMar orchestrates this entire production for you, just for you. Because we know that it will change your life. But we can't just believe it for you. You have to believe it for yourself. All right. You have to see that once I do this little thing of passing NCLEX, my life will be different. Let me show you how to do it. Let me show you guys. I want to be there. I want to be there to help you every step of the way, because here we celebrate every success. You guys know that. We always are rooting for you. So whatever your excuse is today, all right, let me tell you something about them. They don't sound good to me. Whatever you say, it doesn't sound good to me or anybody else. Excuses sound best to the one making them. Your excuses only sound good to you. All right. Because I know, and everybody else around you knows, that you're holding yourself back when you make them. You're holding your own self back. All right. So your excuses don't sound good to me, and they don't sound good to your family or anybody else who's depending on you to get this done. So our Monday motivation for this week is stop making excuses when it comes to studying for your NCLEX. Whatever you have to do, dive head first in there. Go ahead and dive head first. I'm in Florida. I can't swim. When I go to the ocean, I'm watching, but I see people jumping in and diving head first in there. I want to be like that, right? I want you to be like that when it comes to your NCLEX exam, because look, guess what? This is the amount of money that nurses are able to make. And no, it's not about the money, but it is about you having the life that you want. And so if you're not having the life that you want, it's a Don't forget that the party is coming up. All right. The NCLEX party is coming up. And this is for all of those who have passed their NCLEX exam. All right. All of those who have passed their NCLEX exam. Never give up. Yes. So we are here to celebrate you. We're here to celebrate you at every opportunity that we can. Now, Our Monday motivation, our NCLEX studying session, all of that has been served to you. So what do you do now? You take the next step. And the next step may be different for some of you. For some of you guys, it's just going to remarnerscom and giving me your email address so that I can connect with you. For others of you who have the virtual trainer, it is about getting back into your virtual trainer, okay? It is about studying. It is about being one of the ReMar nurses who have passed, all right? We are super excited. We are super excited for your success, all right? So everything that we do here is for you. I can't say it enough. And so for that reason, every Monday, make sure that you're here again. Make sure that you're here again for how to pass NCLEX. How to pass NCLEX. All right, guys. I had a phenomenal time. I'm going to get out of here so that you can continue on with your day. Remember, we're not making any more excuses this week. We are studying, and you absolutely can, you will, and you must pass NCLEX. All right. So see you later, guys. Bye-bye.